Breast Cancer Awareness Month winds down. Medical experts remind us this evening that the breast cancer journey doesn't always end once a patient is in remission. 18 News reporter Ariel Salk explains what side effects from treatment can sometimes last a lifetime. There is now a special team at Guthrie dedicated to manage those symptoms.
Know that you can do so much to go and help yourself.
That's the message 71-year-old Nancy Latimer wants to share after she missed her yearly mammogram and found a lump 1 year later.
I did not do self-exam at all. I mean, maybe twice a year and things, which isn't right, but I didn't. And I just wish other people would realize that it only takes a few minutes.
Nancy was diagnosed with stage 3 breast cancer. Doctors removing all of her lymph nodes on the site her cancer was found to keep it from spreading.
After I had my surgery, 2 weeks later, my hands swelled up to double its size.
Just when Nancy thought she was nearing the end of her cancer journey, she was diagnosed with lymphedema, a side effect that many women face after breast cancer treatment. The condition is caused when fluid cannot properly drain from the tissue due to scarring.
When lymph nodes are removed from under the arm or are radiated, there can be injury to those lymph channels and lymph nodes and scarring, and some of the same pathways that fluid drains from the breast, the fluid drains from the arm. So those tissues can swell, and if they remain chronically swollen, the tissue can become scarred, and then it's hard to treat.
Guthrie's team of 10 certified lymphedema therapists working with breast cancer patients both before and after treatment to help reduce the risk of developing the condition. They say recognizing the symptoms is key.
The early signs of lymphedema can just be like a heaviness feeling in the arm or the leg. It can be a little bit of like an achiness or a pain. Often what starts to happen is after increase in activities, people will notice that their hand swells or that their upper arm is swollen and they're unable to get the swelling to go down.
Certified physical therapists are also working with breast cancer patients before, during, and after treatment to help maintain strength for quicker recovery.
By exercising and staying active, it helps you to feel like your normal self a little bit while you're going through the battle.
Personalized exercise plans tailored to each individual patient mean a more targeted approach to helping ward off the symptoms of lymphedema and other conditions related to breast cancer.
Every surgery and every patient is different and everything is specific. So by coming and seeing a physical or occupational therapist, we can help to tailor a program to exactly what you need, keeping in mind what surgery you had, if there was what tissues were involved, lymph nodes removed, so we'll make sure that you're exercising in a safe manner.
And while lymphedema can be a lifelong condition, therapists at Guthrie want patients to know there's a whole team of people that can help them through it.
The great thing about being a lymphedema therapist is that I get the opportunity to show them that there is a light at the end of the tunnel. We can reduce the size of their limb. They can live a healthy lifestyle and participate in all the activities that they want to do despite the condition.
That type of support making Nancy's cancer journey a little easier.
Every step of the way, I really honestly believe that I have had the right person all along. I have not regretted anything.
Reporting in Corning, Ariel Salk, 18 News.
And we have even more on breast cancer awareness online at mytwintears.com.